Dear audience, welcome to my 12-month progress report where I present my projects that help strengthen the relationship of acute pancreatitis with cancer. My name is Jimin Lee. I'm a recent graduate from Semmelweis University. My vision is to improve the prognosis of pancreatic cancer. And to achieve this, my current mission is to prevent the progression of pancreatic cancer into its later stages by determining its early predictors. So I currently have two specific goals. To achieve these goals, my first project, I'm conducting meta-analysis and systematic review, and my second project, registry analysis. So my first project will be to investigate the effect of acute pancreatitis to the development of pancreatic cancer. Despite the advances in medical technology, pancreatic cancer continues to be a deadly force within the medical field, where it is predicted to be the second leading cause of cancer-related mortality by 2030. Pancreatic cancer is known for its asymptomatic nature, making it difficult to make an early diagnosis and often discovered in its later phases. Therefore, there is a need to clarify various predictors of pancreatic cancer so that we can detect it at a much earlier stage. Acute pancreatitis can serve as a possible predictor. It has been associated with pancreatic cancer, but the exact relationship continues to remain unclear. So with this in mind, we'd like to investigate the rate of pancreatic cancer diagnosis among acute pancreatitis patients. So to investigate this issue, I devised the following question. Does acute pancreatitis increase the risk of pancreatic cancer? So we want to analyze the prevalence or incidence of pancreatic cancer within the adult population with acute pancreatitis. And we believe that the acute pancreatitis will increase the risk of the development of pancreatic cancer. And if we have enough data, we would also like to conduct a sub-analysis regarding the following question. What are the risk factors for pancreatic cancer in patients with acute pancreatitis? We want to see if certain risk factors will have an effect on the development of pancreatic cancer within the acute pancreatitis population. And we believe that certain risk factors after acute pancreatitis will augment the development of pancreatic cancer. And so we conducted a systematic search on 3 different online databases with the search keys shown. We had a total of 32,000 articles and the final result of 50 articles and an additional 7 articles from the reference chaser. So in the next few slides, I would like to present my results that shows the significance of acute pancreatitis in pancreatic cancer. So in my first slide, we analyzed the odds ratio across multiple studies, which shows, and this slide shows the summary estimate of the association of acute pancreatitis with the subsequent risk of pancreatic cancer, where any odds ratio greater than 1 suggests increased risk. As you can see, we have a pooled odds ratio of 6.09, which tells us that acute pancreatitis patients are 6 times more likely to be diagnosed with pancreatic cancer. And so this result is both statistically and clinically relevant. So clinicians should be more vigilant on monitoring this acute pancreatitis patient group so that we can detect pancreatic cancer at a much earlier stage. In the second figure, we analyzed the hazard ratio of pancreatic cancer in acute pancreatitis patients that were followed for 5 years. And from the pooled hazard ratio, we had a value of 3.08, which tells us that acute pancreatitis patients are 3 times more likely to be diagnosed with pancreatic cancer when followed for 5 years. And this data, or this result, is both clinically and statistically relevant, which suggests us that the association between acute pancreatitis and pancreatic cancer is strong and reliable. So in the next few figures, I want to show the odds ratio of pancreatic cancer in acute pancreatitis patients with different risk factors. In the first figure, I show the association with male gender. As you can see from the pooled odds ratio of 1.15, there's only a slight increase in the risk, more specifically 15% in the increase of risk. And this result is both statistically and clinically not relevant. And in the second figure, we want to see its association with chronic pancreatitis within the acute pancreatitis patient group. And we see that with the odds ratio of 3.5, chronic pancreatitis is a significant risk factor in acute pancreatitis for being diagnosed with pancreatic cancer. So this subpopulation of acute pancreatitis group, where patients need to be closely monitored for signs of pancreatic cancer. In the last figure, I wanted to see the association with diabetes mellitus. And we can see that from the pooled odds ratio that there is a 74% increase in the odds of pancreatic cancer in acute pancreatitis patients that are associated with diabetes mellitus. And so from these results, we can get a preliminary conclusion saying that there's a strong association between acute pancreatitis and the subsequent risk of pancreatic cancer, with chronic pancreatitis and diabetes mellitus being significant risk factors for developing pancreatic cancer as well. In a clinical setting, we can establish an adequate follow-up strategy within this population so that we can detect pancreatic cancer at a much earlier stage. And for further research, we need to determine which came first. Is it the acute pancreatitis that came first that caused the development of pancreatic cancer, or is it the pancreatic cancer that caused the acute pancreatitis but was too small or not detected during the episode? So this is the current progress of my first project. I received some of my figures, but not all of them. So while I'm waiting for the rest of my analysis, I'm currently writing the meta section of my manuscript, as well as constructing some figures and tables that don't require the final analysis. So my second project will be a registry analysis regarding the following topic: investigating the effect of pre-existing malignant tumors on the outcome of acute pancreatitis. After discharge, the first-year mortality rate was almost doubled compared to the in-hospital mortality rate, with age, comorbidities, and acute pancreatitis severity being the most significant risk factors for death. It was also found that it was 9 times higher. The acute pancreatitis-related mortality rate was 9 times higher in patients who are older than 60 years of age, which brings us to the question: is this increased mortality rate due to aging itself or due to other comorbidities? One of the comorbidities that was assessed was cancer-related cachexia, which was responsible for the post-AP mortality as well. So which brings us to the aim of our study, to investigate the effect of pre-existing malignant tumors on the outcome of acute pancreatitis. So with this being a registry analysis, we'll be able to evaluate several variables. So we constructed 2 different clinical questions. In the first clinical question we asked is the following: is acute pancreatitis associated with a high prevalence of pre-existing malignant tumors? We want to assess or analyze the prevalence of pre-existing malignant tumors within the adult population that has acute pancreatitis. And we believe that acute pancreatitis is associated with a high prevalence of pre-existing malignant tumors. And in the clinical setting, if an acute pancreatitis patient walks into the clinic, then the clinician can be more aware that this patient may have a pre-existing malignant tumor. For the second clinical question, we want to ask the following: what is the effect of pre-existing malignant tumors on the outcome of acute pancreatitis? We want to analyze patients with acute pancreatitis and compare those who have pre-existing malignant tumors to those without. And we want to assess the outcome in each group. Some of the ways that we can analyze the outcome is through assessing the hospital mortality, length of hospital stay, ICU admission, and complications that we may find within each patient group. And we believe that pre-existing malignant tumors are associated with more complications, greater severity, and higher mortality in patients with acute pancreatitis. And in a clinical setting, we can closely monitor the subpopulation of acute pancreatitis patients so that we can promptly identify the complications that are associated with it and treat it accordingly for a much better outcome. So the registry that I will analyze is an AP registry that was formed by the Hungarian Pancreatic Study Group in 2012. It has 27 uploading centers with a total of 4,241 cases. So I am currently within the preliminary analysis phase, where I'm conducting the data quality check of the database. So to summarize, I would like to strengthen the relationship of acute pancreatitis with cancer so that we can reach a much more favorable prognosis by the early detection of the cancers. So my goal for the first project is to have it ready and submitted by October 2024, and my second project, June 2025. So to end, I would like to quote Marie Curie, where she says, "Nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less. Cancer is a terrifying disease because its nature is poorly understood. With my studies, I hope that we can better understand the nature of cancers through its association with acute pancreatitis, so that we may fear less." Thank you for your attention.
Congratulations for the presentation. Yes, question, please.
Thank you for your presentation. My question is regarding for your first project. What is the average time between the diagnosis of acute pancreatitis and the onset of the cancer? And the second question is, what is the protocol to follow up acute AP patients?
So I'm still having my rest of my data analyzed, but from what I've seen in the project, or from the data that I've reviewed, it seems that the highest amount of diagnosis was found within 2 years of AP diagnosis. So yeah, that's the first question. The second question was the protocol, right? Currently, there's no accepted guidelines of the follow-up strategy for acute pancreatitis. So if my data turns out to be highly significant, then I think we should propose more guidelines for the appropriate follow-up strategy in acute pancreatitis patients.
Thank you very much.
Okay, can you please tell me what is the occurrence of acute pancreatitis in patients with malignant disease? Do you know anything about that, or do you have any number?
No, unfortunately, I have not looked into that yet, but I'll make sure to look into it for sure.
And what were the underlying malignancies mainly in your study?
Within the second project?
Yes.
So I'm still looking over the data to see what kind of data we have, but from what I've seen, they didn't really list out what kind of malignancies they had, but some of the ones that I've seen were like melanoma, gastric cancer as well. Yeah.
Okay, all right, thank you.
Congratulations. It's well known that diabetes and chronic pancreatitis is a strong risk factor for pancreatic cancer.
Yes.
But if you exclude those patients with those diseases, acute pancreatitis is still a risk factor for pancreatic cancer?
Yes, according to my first figure, which is only seeing acute pancreatitis and the risk for pancreatic cancer, we see that there's a 6 times increased risk for...
So there were no included patients with acute pancreatitis and diabetes mellitus or patients with relapsing chronic pancreatitis in your first study?
That is one of the limitations for my first project, is that we couldn't kind of divide which patient had acute pancreatitis and which patient had those risk factors. So the results from the first figure was just reported that these patients had acute pancreatitis and had pancreatic cancer. So I'm unable to say that if these patients had these risk factors as well, because they did not report it.
Okay.
Yeah.
So I don't know, acute pancreatitis is really a risk factor for pancreatic cancer, or there is a more awareness of these kind of patients, more regular follow-up, and that's why there is an earlier diagnosis of pancreatic cancer?
Yes.
What is your opinion? Is it alone a risk factor, or there is an more frequent follow-up of these kind of patients? That's why we diagnose more frequently the pancreatic neoplasm in such kind of patient.
I personally believe that pancreatic cancer is the cause, or what causes the acute pancreatitis, rather than acute pancreatitis being the risk factor. Because from the data that I've seen and is currently being analyzed, is that the highest amount of diagnosis of pancreatic cancer was within 2 years or even 2 months. So I think it's more closely associated that pancreatic cancer is the cause rather than acute pancreatitis being the cause of the pancreatic cancer.